Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Now, how are you going to diagnose the Graves' disease? So, in the diagnosis of Graves' disease, first and foremost, in the Graves' disease or in any thyroid issues, first and foremost, you will do a thyroid function test. In the thyroid function test, you will see that there is decreased TSH is seen and there is increased free T4 and T3 levels are seen. Obviously, it is a hyperthyroid state, so there is decreased TSH and increased T3 and T4 are seen. And eye signs are also present in these patients. And if eye signs are present, then obviously, if there is thyroid function tests with eye signs are present, in such cases there is no other tests are needed. So in such case you can easily diagnose the patient has Graves disease. So you can diagnose it has Graves disease. Now if the patient has decreased, thyroid function test shows decreased TSH and increased T3 and T4, but eye signs are absent. If eye signs are absent, then you should do a radioactive iodine scan. In radioactive iodine scan, you will see that there is diffused enlarged thyroid gland is seen. You will see that there is diffusely enlarged thyroid gland is seen, and this diffusely enlarged thyroid gland will confirm the diagnosis in this case. So if thyroid eye signs are present, then no test is needed. If eye signs are absent, then you should do a radioactive iodine scan. Next, in the Graves disease, there is if you do an antibody tests, if you see that there is increased TSH receptor antibodies and if thyroid stimulating antibodies are elevated, then obviously it is diagnostic in Graves disease. And but if antithyroglobulin or if antithyroid peroxidase antibodies are elevated, these antithyroglobulins and antithyroid peroxidase antibodies are non-specific for Graves disease and they are elevated only in up to 75% of cases. So they are not diagnostic, but they can give a suspicion about Graves disease. But the diagnostic antibodies are elevation of thyroid stimulating hormone receptor antibodies and thyroid stimulating antibodies are diagnostic in this case. Now, if there is a Graves ophthalmopathy, in Graves ophthalmopathy, in order to evaluate the Graves ophthalmopathy, we will have to do an MRI of orbits is indicated for evaluation of Graves ophthalmopathy. Then, what about the treatment of Graves disease? For the treatment of Graves disease, in the treatment of Graves disease, we have some treatment modalities. Obviously, this is a case of hyperthyroidism. So, because it is a hyperthyroidism, definitely we should give anti-thyroid drugs are indicated in the patient. Along with that, we can do a thyroid ablation can be done with radioactive iodine, and thyroidectomy is also done for Graves disease.
thank you and thank you for watching.